Hi, everyone. Welcome to the Beauty Outlaw. Guess what? I can't even believe this. Today, I have the expert beyond expert with me. I came to her to show you this amazing location, aesthetic immersion, educational facility for anyone that wants to dive into the world of aesthetics. Lori Robertson. I reached out. I told her, this is what I said to you, Lori. I said, I'm a little fish in a big pond, and I need a big fish to help me out. And do you know what she told me? I will do whatever it takes to help you get the word out. So she is here with me today. I am here with her today. Thank you, Lori, for being here.
You're so welcome. I'm honored that you asked me to be here. I am. I love everything you're about. I love what you are trying to help with. I love aesthetics. I love everything about what you're doing. Thank you so much for just getting the word out there and increasing awareness as to what we do and how we do it and the importance of things that we do. But thank you. Thank you, Jerry.
You're welcome. You're welcome. She told me thank you. I'm so incredibly honored. So Lori, we have one thing in common, our years in the world of aesthetics. That's what I love about you. And that's what really perked my ears up about you years ago. I was like, okay, she's medically based. So, Lori, I want to know your story from the beginning. You have been a nurse since 1982. I know that about you. So share it with the rest of us.
I have. It's been a long road. It's been quite a few years. So when I always wanted to be a nurse, and it just it was something I always wanted to do. It's like my brother was always going to be the doctor, and I was going to be the nurse, and that's just kind of how my head was. So in about 1980, my brother and I had gone to Pepperdine to get my undergrad. My brother had gone to Loma Linda. He's 2.5 years older, so he's always the smart one in the family. I'm the cheerleader. Okay. So I was cheerleaders. I knew I just wasn't. Yay, cheerleaders! I just knew I wasn't. I didn't feel like I was ever as smart as he was, and he was going to be the doctor. So that's how it was, kind of in our house. Not intentional by my parents, but that's just how it was. So he left Loma Linda. I left Pepperdine. We both went to Rio Hondo Community College for nursing. So that was the first time ever that we had been in the same classes, which is kind of neat, having my brother in there.
Lori, that was an associate's, right?
That was an associate's program.
At the time.
So I was in Whittier, California. And what was interesting was very quickly I found out that I wasn't as stupid as I thought I was, that he and I would vie for the top grades in the class all the time. And it made me go, wow, I always thought he was the super smart one, and I'm doing okay here. So it was really interesting. I always say, don't sell yourself short, because we can do more than we think we can do, and the only thing that limits you is you. So it really opened my eyes a lot. So I kind of had that understanding going forward. So in 82, I graduated with my associate's degree, got hired into ICU right away.
Welcome to the world of health.
Oh my gosh. So I guess that's where they needed me, right? I'm like, okay, great. I wanted NICU with these little babies, be easy, little messes. I'm all good. ICU was like, okay, I'll go there. But then when I first started working there, it was so intense, and there was so much I needed to know that it was very, very scary. And I remember for 6 months driving my car to work and going, please, God, don't let me kill somebody, like every night, because I just didn't want to hurt anybody. And I didn't, but what I did was every day I learned something. And back then, we had nurses that were very helpful, and they mentored, and we had a great team that would help us. And I hear, like, sometimes it's not so much like that anymore, but it was really, really nice. Back then, you remember, it was great. So they nurtured their young rather than ate their young back then. And I learned so much. I worked in ICU for 7 years. Then I went down to ER and worked in ER for about 11 years in a trauma center in Whittier. Was a mobile intensive care nurse, so I was on the radio giving all the orders to the paramedics. Loved it. I loved ER. Loved it. Kind of during that time, about 89 or so, I had a friend from Pepperdine who she had gone into the TV industry, and I went into nursing. She had called me and said, hey, look, Lori, she worked for a big management company called Cunningham, Escott, and DePini, a big agency. She said, we're looking for a nurse to play a nurse on a show. And I'm like, okay, why are you calling me? And she said, because I think you'd be really good to do it. And I'm like, I took drama in high school. I'm good. And she's like, no, really. So I went and auditioned. and I ended up getting a call back. So that call back, when I went back there again for the audition, I got the part. And the show was called Group 1 Medical. So I was doing ER while I was doing that, which was fine.
Lori, was this on one of the major channels at the time, like 247 or?
It was, but I couldn't tell you which one.
Okay.
MGM produced it. They produced it. So that show kind of went just for a year. And actually, I thought it was boring. So you're kind of peeking in at doctor's visits, and they had real nurses kind of, it is what it is. But the director who directed that show also part-time directed General Hospital. So when our show closed down, I don't know if you even know this.
I do.
But our show closed down, and he said, "Hey, Lori," he goes, "why don't you come over and talk to the executive producer, who was Wes Kenny at the time, and see if he could use you on General Hospital?" And I'm like, "What?" I go, "I've watched that since the baseball team at Pepperdine got me into it."
Luke and Laura.
Yes. And they stopped their practice every day and watched General Hospital, the baseball team at Pepperdine.
It was the best.
So it was Luke and Laura back then. So I went and talked to them, and I didn't audition. I went and talked, had a meeting with them, and they said, "You know what, we really like you, and we could put you on as an actress, but then we could kill you off. We really need somebody like you to be a medical consultant." So I said, "I didn't even know you guys had one." So they said, "No, we do. We need that. We have somebody talking around their ET tube right now or whatever." So I said, "Okay, that sounds great with me." They said, "You're union, so we can put you on the show." So in '89, when I was still in ER, that's what I did for quite a while. And I did that for about 19 years on General Hospital. And then we had a spinoff called Port Charles, and I did other shows like Quantum Leap and Knots Landing and those other nighttime shows too, and some feature films, being the medical consultant, which was neat because it's another thing that we can do with our medical knowledge. And I review all the scripts, I order all the props, I go onto the sets, set them up so that the cameras can't see that the IVs aren't running and the tubes aren't, like nothing's dripping, and you can make sure that
it needed to look real.
It looks real, and they just dub in the sound later. So that was really fun. So I did that for like 19 years. That was neat. But all the while I was in ER, so that was the 11 years I was in ER. After ER, I went into management positions, both nursing supervisor and access coordinator at our hospital, and did that for about 3 or 4 years until I ended up going for my nurse practitioner. When I became a nurse practitioner, that was in 2000.
This was not, what year?
That was 2004.
Okay.
That I became an NP.
Okay.
Well, back then, our hospital had no PAs or nurse practitioners, so I really educated myself right out of a job. So I'm I guess I need to go look for a job because there was nothing. So I ended up going and working in urgent care and family practice, and did that for a few years. And then a friend of mine, another nurse, called me and said, "Hey, Lori, I saw this ad for Buddy Botox." And I'm like, "Okay." So we went. It happened to be Gideon, my partner now. We went to this office and we sat down, and I was looking around going, "Wow, this is really kick back. It's chill. There's nice music.
It's not the ICU or the ER.
Oh my gosh. The doc is sitting here talking to me, and he has time to chit chat. I mean, that was a new thing all in and of itself. So I thought it was just really interesting. And I'd worked forever, in acute care, and I thought, this is interesting. So what I did after that was I went to a couple conferences just on my own, and they would talk about laser physics, and I was like, I have no clue what you're talking about. They were talking about fillers, and I just kind of wanted to get an idea of what it was about. And it really interested me. So I went back to him and I said, "Dr. Kwok, this looks really interesting." I go, "Would you by any chance be willing to hire somebody new?" He's like, "Yeah, sure." So he hired me into the Whittier Clinic, and it was a smaller clinic, and the PA that was there was pregnant, and she was ready to go off on leave having her baby in like 6 months. So I would have 6 months of doing it. Well, I kind of hung on to my family practice job for like 3 days and just did aesthetics a couple days a week just to kind of see if I really wanted to do this. And I end up, every day I'd go to work, I loved it. And I would learn more and more. So at 3 months, me being there 2 days a week for 3 months, she had problems with her pregnancy and went out. So I was by myself.
Oh.
So it was sink or swim. And I almost think that's what threw me into the trajectory of seeking information and learning and constantly wanting to know more, because I was responsible for these patients. And back then, I was more afraid to do Botox than fillers.
Oh. So
does that tell you what we didn't know?
Yes.
We had no Hylenex. We just stuck needles in. We didn't know about occlusions, nothing. There was no research, nothing. And I look back and go, how did my patients come out unscathed? how did that happen? So it's just like, oh my gosh.
So true.
So by the grace of God, I didn't hurt anybody, and we just continued to go on that trajectory of learning, of just that thirst for knowledge and knowing I will never know it all. And the more I learned, the more I realized I don't know. So that sent me into aesthetics, and I've been doing it now for about 17 years, just full-time 17 years, been teaching since 2012, internationally for about the last 5 years. So I feel like I am Cinderella. I feel like I am so blessed to be where I'm at, that people want to hear what I have learned, and they want to hear what I have to share through my goods and bads and experiences.
Amen.
I just, it makes it so special when people come up to me and go, my gosh, Lori, I learned this, or I learned this, and I do this way because I listened to your lecture or your Instagram. And I think, okay, I'm leaving some type of legacy. I'm helping somebody learn and be safer. So it's just been an amazing journey. It's been amazing.
Well, I do think that you're amazing. And I think it's because my personal opinion is that you've held the foundation of being a medical practitioner. You have looked at the patient as a whole patient first and given a full, whether it's a focused assessment or a full assessment, you still look at them as you are their primary caregiver. And you look at them in the whole person. And it's not always just about their immediate wants and needs. You also do, I'm pretty sure you do a pretty good faith exam.
I do. And it's so interesting that you bring that up, because there are so many people going into this who don't have experience, and they're just going into it for aesthetics. And that's all well and fine, and they might be great. But what I've noticed with me is that my experience has helped me literally save lives in aesthetics. And I'll tell you an instance. A few years ago, I had a gentleman come into me to get Dysport. And I could just kind of chit-chat and ask some questions. How are you doing? What's new? Oh, I'm doing great. Any new medications? Oh, yeah, I'm on some antibiotics. Oh, really? What for? Oh, this thing right here. And I said, oh, okay. Did you have a sore throat? No. Did you have fever or anything? No. I go, okay, what do you have again? What's going on? He goes, oh, I have this little thing right here, this little bump right here. And I went into my doc, and they gave me some antibiotics. And so of course, red flags are going up with me. And so I'm like, let me check this out. So I palpate this firm, mobile, non-tender mass. You know? And I said, is this tender? No.
We won't be getting Dysport today.
It's firm and mobile. And so I'm like, this is something that we need to look at. So that day I got him in for an ultrasound of his neck and an ENT consult. And it was adenocarcinoma of the jugulogastric lymph node. And he, to this day, knows that if I hadn't, and that's only because my antenna are up. It's like I always have differential diagnoses in my mind. I'm looking at somebody, and I'm looking at their skin, I'm looking at them, I'm listening to them, I'm looking at the size of eyes. If I didn't have years of background of being aware of that, I wouldn't be able to pull that into my assessment. And what I noticed is, like, I had a patient the other day, this last year, that she came into me and just for Dysport. And I was looking at her and I said, did you ever notice that, like, one eye is a little bit more predominant than the other? It was tremendously predominant. And she's like, yeah, I did notice that. I said, well, have you ever been to your doc and have that checked? She goes, I just had a physical like last week, and they said I was all good. She had significant exophthalmos in one eye. And I said, you know what? You need to get checked. You need to get your thyroid panel checked, and you need to go to an ENT. And so she ended up going. Yes, she is on medications now for reduction of that. But I'm seeing things that primary providers are missing. And I think this is what's really important for all of us in aesthetics to remember, is that we see patients more frequently than their primary care providers. So we really need to be aware of that holistic patient, of everything that's going on with them. Don't just look at their wrinkles. We need to look at everything about them and listen to them and ask those questions when we get a little clue that something's going on, because we can literally save lives in aesthetics. And you would never think that. But we're put in that position where we have the time and primary care providers,
Do not.
given the reimbursement of 10 cents on the dollar, they're cramming patients into physical in 15 minutes, and they can't. They can't. So I think it's really important that we as providers are aware of that. Really important. And that's why
we're dispensing a medication. I think sometimes we forget that, injectables and filler, and it's a medication. And before we give any medication, we need to do a whole assessment of the patient and what they're all about and what's happening with them. And I think that's the beauty of having some experience in clinic, we'll get to this later, but in clinic and in hospital, I think those things they really carry you far. And as a nurse, you're a family nurse practitioner. But as an RN or a PA, you are given you're given this opportunity to be able to perform these aesthetic procedures by the grace of your medical director. And you can do a focused assessment or an assessment, and you owe it to your medical director and your patient to be able to find out if there's any contraindications prior to injecting those medications into their body.
Absolutely.
And I love that you are hitting a nerve with that. A lot of people don't like to hear that.
The
I
truth
like to hear
hurts.
it.
The truth hurts. And it's so true, because when I sit down with my patients in a consult, I will tell them, or when I'm going to treat them, I'll say, I'm going to be putting jelly in your face. Okay, here's the product.
Jelly.
I say it's like a jelly, but it's a product. And if you want to know it, if you want me to explain it to you down to the molecular structure, I absolutely am happy to do that. If you want to know that, because I know this down to the molecular structure. It could be a toxin, it could be a filler, whatever it is. I think I owe it to my patients to know everything about everything I am putting in their bodies. They are trusting us. Our patients are trusting us. And if we don't know how toxins work, it just relaxes a muscle. Well, how does it work? Then you know the contraindications. You know what else it might affect. If they have a neuromuscular disorder, do you want to give it? Certain fillers, if they have autoimmune, you probably don't want to put them in.
Sculptra.
Right?
People just throw Sculptra in autoimmune. People that have autoimmune disorders, I'm like, ask the question.
Absolutely. Absolutely. So our medical questionnaire is very geared towards aesthetics. And actually, I recently added the MTHFR gene onto that, because reading, and I do nitrous.
Write this down.
I do
everyone.
nitrous on, right? I do nitrous on some of my treatments, and I offer it to them if they want it. Well, I've read quite a bit where the MTHFR gene mutation there can be a problem with an excessive, you can't break down folic acid. So there's an excess homocysteine. It raises homocysteine levels. It can bind to B12 and drop B12, and it can cause death in even kids with that genetic mutation. So when I read something like that, I'm like, I want to know if somebody knows they've got that mutation, because I know I'm not going to give them nitrous. So there's a lot of different things on the questionnaire that are very specific. Do you have autoimmune? Do you have any metal implants? There's a lot of questionnaires they're like, why are you asking this? It's like, I do radio frequency. I do things that cause collagen stimulation. All the things that I ask them have to do with what I might be doing.
Protecting them.
Absolutely. So
Protecting
that medical
your
questionnaire needs to be very specific to what you might do with them and do on them. Yeah.
Lori, I think that aesthetic immersion is the heart and soul of it is about what we're talking about.
Absolutely.
Because I really believe that it's in your DNA, in your soul. It can't move on from there. Yeah. Like, you're going to take people through the basics of the assessment of vasovagal.
Oh my gosh.
The simplest thing.
And do you know how many people don't know what a vasovagal is? They know what it's called. They have no idea
how it works in the body.
What the pathophysiological basis is of it. It's crazy. So what we teach in aesthetic immersion, we don't tell you to inject here. Mm-mm. We want to teach critical thinking. We want someone to have critical thinking. You read the skin. You look at that. You look at the reflection. You look at flatness. You look at their anatomy. You look at pre-existing volume. You look at what they've lost throughout the years. There's so many things we want you to learn to assess and use your critical eye and take that to each patient, but they're not all going to be the same. Nobody's the same. There's no two foreheads that are the same. So you can't inject them all alike. So we try to instill the very research-based material along with that critical thinking. We want our students to think for themselves so you can take that and apply it to any patient you have. Really important.
Do you think, okay, I might be setting you up with this question, but do you think in big pharma, who is kind of running the show with aesthetics, without them, we couldn't perform these wonderful aesthetic procedures. Do they have an obligation for, say, post-surveillance to go in and really delve into complications?
They do if they're reported.
If they're reported.
Do we know how many
Do you
adverse
think
events
that's
are reported?
Yes.
Do you know how many, according to CDC? Like we look at like VAERS. I looked this up during COVID. What percentage of adverse events are ever reported? One.
So they're underreported. Would you agree?
Very underreported. I think all adverse events are very underreported. They are. And I think that might be too, because whenever I've reported them, it's a pretty convoluted system. And if there's a reaction to a drug, if the doctor's obligated to report it, but they don't, because it's just such a long, mundane paperwork and system and calls, and so I think it's tough. It's tough. I think we need to report it. They need to know what's going on. Sometimes even if it's not related to like I had a patient come in that had counterfeit product injected in her lips, and I had the company look at the label and say, okay, I said, can you tell me if this is real or not? And it took a while. It took going all the way up through the company, and they finally said, you know what, the lot number is the right lot number, but that one expired 5 years ago. Because there's an extra -6 on it, that's counterfeit. So it looked very real, like a product that was from another country, but it took a while to research this. So when that patient came in and I dissolved them, I still had to make a report with the pharmaceutical company, even though it was counterfeit product.
Interesting.
Yeah.
How do you feel? Do you deal with a lot of complications here? Are you guys set up for that? Or how does that work in your, do you take on other people?
I do.
Is what I'm asking.
I do. That's where my complications.
That's where you're seeing
knock on wood. I'm knocking on wood. I've never had a vascular event
blessing,
yet.
right? Yeah.
But I know it could happen any second. So I'm very, very acutely aware of that. And I don't know, I shouldn't say I don't know. I used to not know why it didn't happen. Now I realize I'm very thoughtful and gentle in how I inject, and I'm very anatomically based. It's like I know the anatomy, and when I use cannulas, and I'm extremely gentle, and I have techniques that I think help people be safer. But I think it's interesting. It's kind of interesting. And
do you aspirate, Lori?
With a needle, always.
Always with a needle.
And I have a technique with needles that I'm currently doing with a research piece with Dr. DeCates, that we are researching a better way to use needles that are even safer regarding that our aspirations can be a little bit more appropriate and not have false aspirations. So I think that's going to be game changer. A game changer.
I agree, because it's it is a false sense of security when people pull back and they're using a thicker gel, and it takes longer to get.
The stretchier a gel is, you might not ever clear your needle of the product. And we've seen that over and over. If a gel is very thin and stretchy, you've got so much leeway in the syringe, you don't get a lot of negative pressure, so it doesn't pull it out of the needle. So it can be a really false aspiration. So I'm working on that. And as far as cannulas, no, I don't aspirate with cannulas. You can, though. You can aspirate with cannulas. The reason I don't is because I am so gentle and I don't pop through anything.
You've talked about that
Don't
before
pop
in your
through
videos.
anything.
Very gentle and no pressure, hard pressure.
It's like Helen Keller. You're not pushing your cane through doors. You're tapping to find out where you are. And if you are able to you're feeling the speed bumps, you're feeling the little bump, the curb, you're feeling things, right? And if you know the anatomy, then you know what you're feeling. You have to have an intimate knowledge of anatomy before you go sticking stuff in the face, I hope. But I see this all the time when I train in cannulas. I see all the time people are like, yeah, I do it every day. I'm like, okay, great. We'll do, like when I train with a pharmaceutical company, and I love cannulas. So I'm like, great, you know how great you use them every day? Let's do cannula in the midface. And they are stinking in the superficial fat, and they think they're in the deep fat, and they don't know what layer they're in. It happens all the time. So I'm trying to help people understand how to use them appropriately, but knowing anatomy intimately that's the foundation.
You use a word that I love, by the way. It's 2 words. Time on tissue.
Yes.
3 words. And you use that a lot.
I do.
And I love that. I really do, because it makes sense. You are only as good as your time on tissue.
You are. And when people come and they say, I've been doing aesthetics for 3 years, I'm like, okay, well, I see on your resume you also work in ER and you work in labor and delivery. So how can you do them all? Oh, well, I work in aesthetics a day a week or a day a month, and I work in, that's not 3 years. So you have to, when you interview people for jobs, make sure it's like 3 years, or you want at least 1 year maybe experience or equivalent. So if you've got 12 months of 1 day a month, that's only 12 days. If you've got 1 day a month for 12 months, that's 12 days of experience. So understand that when you're interviewing people, because frequently they'll put like, I have 3 years of experience, and they're counting in their 3 classes they took, and they're counting in the 1 day a week of 3 months. So just
unless they're fortunate enough to have you mentor them after a class or 2.
Yeah, I have an apprentice now with me that I hired out of our classes. She was brand new. And I tell you, I interviewed for probably 6 months and couldn't find the right fit, couldn't find somebody who had kind of the core values that we want in my clinic. You just want to find that right fit. Whatever the values are, stick with it. And it was hard for me to find somebody that had really good critical thinking and common sense. And those are 2 things I look for. So they take a 2 to 3 page quiz before they get to me. So my office manager interviews them first. If they pass that, then they'll come in and they'll take a quiz. And the quiz is to kind of let me know what they know and what they don't know. It's not a pass or fail. It's like, where are they in the scope of aesthetics? What's G prime? What's rheology? Just things like that. How do toxins work? So I'm not going to give it all away, but I kind of want to know where they're at. And this provider had never worked in aesthetics, and yet she answered that better than most people who have experience, because she used her critical thinking, like, okay, if I have an occlusion, this is what I would do, then this is what I would do, then this is what I would do. And I was so impressed. So, she's been with me like 3 months, and she's doing great.
Moldable.
Yeah. Yep.
Like you can have her.
It's funny because now I'll have her educate patients, and it sounds like I'm listening to myself. I'm like, the best. You go, girl. But I keep telling her, it's like, I'm not the only one. You don't have to go by my way. But I mean, like, I'll give you one way, and then you just go to different classes, and you figure out what pearl you want to keep. When you go to courses and you're an experienced or not experienced, well, mostly experienced, but when you've done this for a while, you'll go get education from people, or they'll come to you, and you realize, like, I'm going to pick up this pearl. I like this. But you're like, nope, I'm not going to do that one. But I like this pearl. I'm not going to do that one. And you kind of pick up what works good for you and your style, in essence. So I tell her, I'm like, don't just think I'm the only one. This will give you a good foundation, but I want you to kind of explore other things too, so you can get a really good broad aspect of different techniques that are used.
So when you mentor or shadow someone, or they shadow you, do you do multiple, or you probably only have time to take on one little bird at a time?
If there's if someone shadows me, they just fly in for the day or wherever they're coming.
Okay, and you do a shadow, 1 day.
I do shadow. That's just where they just.
But mentorship
is we have an apprenticeship through the aesthetic immersion.
Okay.
So we have her going through an apprenticeship program, but I've hired her. I've hired her into my clinic, so I'm keeping her. But
you're getting her ready to work for you.
Absolutely. But the mentorship program is 6 months long.
Okay.
And she's with me every day, 8 hours a day. And she is she's literally, sometimes I bump into her face. She's right here. I love it, though.
I feel like I met her when
I love
was
it. You probably
did. She was
did.
A doll.
Yeah, she's
Total
super
doll.
sweet.
She's an NP, right?
She's an NP, and she came out of family practice in emergency. So she
doll.
She's really
personality, very sweet. Oh yeah,
and good with patience.
Yeah,
and it's patience first. It's them first. It's not the money. So, and that's one reason why we don't have commission, which is illegal in medicine, by the way.
Yes.
It is. Hello. There's so many commissions out there. I'm like, it's illegal in medicine. But I don't do that. I don't want to have their focus be money and how many I can sell and how many syringes can I put in somebody. I want it to be that outcome. And I want it to be safe and beautiful outcomes and natural outcomes. So yeah, I don't want to force that that on anybody. I want them to do their work and not have that pressure.
Oh,
yeah.
She's probably getting so amazing too. I mean, are you watching her
She's done Sculptra. I've started her learning cannulas, doing fillers. So she's starting with cannulas. And literally, the other day, she was doing some mid-face filler, and she had the cannula in the face, and she was feeling it, and she had her hand here, and she was actually looking off, and she was just feeling the ligaments. And I'm like, you go, girl, you're doing good.
Your opinion. Mm-hmm. I know you use cannulas.
Yeah.
Do you think cannulas are safer than a straight needle? Or do you think it's in experienced hands that a cannula is safer?
It's totally whose hand it's in. Mm-hmm. I think they can be just as dangerous as needles. And people feel too confident with cannulas. Over and over again, I see cannulas getting jabbed and shoved because they feel comfortable. And I'll tell you something that really frightened me is that I saw on Instagram a provider post who was extremely experienced, like an educator, who was posting a picture of a 22 gauge cannula with filler on it and being proud that they aspirated blood. Like, look, always aspirate. And it's great. I think aspiration is terrific. But the fact that somebody shoved something hard enough to get a 22 gauge through a muscular arterial wall made my heart stop. I just thought, they just don't understand. They don't understand the whole concept of being gentle and feeling.
Or the concept of cannulas.
Right?
And what makes them a safe alternative.
I would say they're safer in the right hands. Mm-hmm. That's it.
You brought up something I want to talk about, and that was what you saw on social media. Let's talk a little bit about social media and what you think of the whole thing.
Do you really want me to go there?
I do. I do. I have my own opinion.
Let's open that can of worms.
It's your opinion today.
Yeah.
It's a beauty and a beast.
Absolutely. I think it's the best and the worst of aesthetics. I think that the focus has come off the patient and come on to how popular can I be? Who can I be standing next to? Mm-hmm. Who can I sleep with to get where I want to be? Mm-hmm. Some people have really good social medias and they can't handle their own adverse events to save their life. So it's really, and those people sometimes get asked to speak at conferences and they relay inaccurate information on podium. So those of us who have been around for a long time, it actually takes away from the legitimacy of those conferences in vetting the speakers. Mm-hmm. So I think it's the best and the worst. I think that if we concentrate on our patient, it's not how much I can get my hair done and my makeup done in the morning before I go out and what kind of a Chanel outfit I can have on. That's not what it's all about. It's about learning. Mm-hmm. And I'm going to be doing a course in Norway with Julie in August. Nobody else knows about this.
She's speaking of Julie Horn.
Julie Horn and myself are going to be doing a 2-day course. And she's going to do the first day being lip masterclass. I'm going to do cannula masterclass the second day. And it's actually going to be the attire is going to be jeans or scrubs. Oh, take all that away. And it's just like Learners and Legacies that Mary Beth Hagan has put together this wonderful conference called Learners and Legacies. It's people who speak have injected no less than like 13 to 15 years. And it's jeans. You take away that precociousness and you're just there for quality education. So that's what Julie and I kind of want to do with this is you just come, you bring your scrubs, you bring your jeans, and you're there to learn. You're there to absorb.
Taking the makeup off.
Absolutely. Mm-hmm. We don't care. Put your hair in a bun and just come to learn. So, yeah.
I love it. For those of you that don't know everybody knows that's listening to this, who Julie Horn is. She's the lip queen of the world.
Yeah.
She really is truly amazing at her technique. And I love that you guys have teamed up recently. There's been a little teaming up with you guys. Yeah. And teaming up with her, how does it feel on Instagram and you go to these events? Lori, how does it feel to be a rock star? To be a celebrity.
You know what? That is just still so. I'm almost uncomfortable with that because I feel like I do everything. I do the same thing everybody else does. I feel like that. So it's still really strange for me. It really is. I feel like I'm not worthy to be at that status. But on the flip side, I'm so humbled. And I feel like I'm so blessed that I've made an impact on injectors and nurses, doctors alike, PAs, whatever. I just think I'm humbled by that. But it's still very surreal to me to like people like, look at your picture. And I'm like, okay. It's just really neat. It's allowed me to meet so many people. And I feel like now I have met so many friends across the world. It's wonderful. Like I go somewhere and it's like a class reunion because I've already met and talked to people, and it's really kind of a fun social thing. The conferences for me are very fun and social too. It's just catching up with people you haven't seen for a while, and you meet people that way, and it's neat. But I still feel very awkward and like I don't belong in the limelight. So,
but that's why you're deserving of the success you're getting. Because when you take on that humble place in your heart where you don't feel you deserve that kind of exposure, but you're still willing to give back, that's why you're getting what you're getting. And that's why you've got that in aesthetics, Lori is a superstar. And now that, I'm sure that you're watching me like you never knew who Lori was before. Lori, so I'm a super fan. I'm one of those goofy super fans. And I was just, you're just a real human being. And that means that the information you're giving everyone is real. And you're giving real experience and you're sharing that with us. And it's super important for the people on the other side. We've got so many newbies, right? So many people wanting to get into this fun world of aesthetics. And I feel like there's not enough of the right education. And I'm really impressed with what you guys have taken on here. It's a big responsibility, Lori.
It's huge. It's
You're
so much work.
Taking a big responsibility on. What do you see this? Where do you see this going? What do you want the end game to be?
We're going the direction we wanted to go. We've got the aesthetic immersion is growing tremendously, but a really nice, slow and controlled growth. So we don't expand too quickly. We want to be very thoughtful in what we're doing. Gideon and I are we feel very strongly about quality education, about research-driven education. We see a lot of schools popping up because it's like the popular thing to do now. And I was talking to my husband the other night, and I said, they're everywhere, and I don't think injectors know how to choose what school to go to because they all say that they're the best school. And I say, just look for one that's accredited. Look for something where you're going to get your continuing education units because you know that school has gone through the hoops, and it's a lot of work to get accredited. The other thing is kind of look at the instructors, vet those instructors. How long have they been injecting? How long have they been teaching? Just kind of vet those instructors. And I think that some of those kind of other schools that pop up, they're going to realize how much money it takes, how much money you don't make it's not a huge moneymaker with schools. You're teaching out the goodness of your heart. It's not like you're going to make millions of dollars just by having, students, not especially like we just have like maybe 10 students a day. So you're looking at, this isn't like 100 students. We want one-on-one, an hour with each student. We want quality and it's not quantity. So you have to make sure that you've got good time on tissue. You've got good somebody with you holding your hand when you're injecting. and when you want to learn something new. Like I say, if you want to step it up, you can come to our school and go, Lori, I've been injecting for a couple years. I've never done tear troughs with a cannula. Can I try? You betcha. I'm here. I will hold your hand. So we're there to help them, be there as a mentor to help them learn whatever they want to learn.
You do something unique here too. Something with videoing, like you'll video and mic the student. Is that?
We do. Yes.
Okay.
So in our courses, what we do is we mic up each student. Like we have mics and we mic up each student. We have students both live here at the studio, and then we also have virtual students. So students will buy a virtual program, and we offer that a few times a year. They'll buy that and they'll peek in and just watch the whole day if they can't be here in person and listen to everything we say to our students because we're mic'd up. So everything's recorded. Our team will edit that over the next week, and then we put it up for the students to watch again so that they can look and go, okay, what did Lori say? What did Dr. Kwok say? How did I
that.
do
We
that?
forget everything when we leave a course.
You do. We do.
20%
and it helps
stays, that's it.
reinforce that. The other thing is we give them 19 modules to learn before they come here. So there's about 12 hours of didactic that they need to go through and take tests and pass before they get here. So we know foundationally what they've learned. So we know they've learned the right information. How long, can you not exercise for 2 days after Botox? No, no. So there's a lot of wives' tales that we dispel, and we know what they have when they come in. So they have that foundational knowledge, and so we build from that. So we have a lot of students that come in who have taken a lot of other courses, and they're like, oh my God, yours was so much more in depth. I learned so much in your didactic, and we give them a year to rewatch it. So if they go out there and inject and they're like, oh, what was that anatomy again? They can go back to the anatomy module, go look at organs and insertions of muscles and kind of look at all that and reinforce that.
I love students like that.
Yeah.
That's the kind of student I am.
I love that.
You never stop learning, and you always, Lori, I would imagine sometimes you could go home at night and question yourself every now and then.
Every day we question ourselves.
You're like, God, right?
Well, here, I'll tell you what happened today. I had a patient who I give everybody I inject my Google number. So, if you're a provider and if you're owner of a clinic or whatever, the Google number is free. So if the Google number is called, it lets my cell phone know that somebody's calling from Google. So I know it's either a patient or my website. That's the only Google number. So I get this text of like, Lori, my lip is white. And I'm like, okay, here's my first one. Here's my first one.
Hold on.
And she was flipping it up in the picture, and it was white underneath. And I sat there going, okay, I'm like, anatomy, I inject under the superficial mucosa. How in the heck could that be white underneath? And so I zoomed in on the picture, and I saw petechiae all the way around the white spot. So later on in the afternoon when I spoke with her, I said, do you by any chance bite your lip when you were numb? And she said, oh yeah, I did. I go, you bit your lip. You bit it hard. And she's like, oh, I guess I did. I'm like, yeah.
I saw your teeth marks on there with the petechiae.
Petechiae all around this way. So anyway, so I'll follow up with her tomorrow. But still, it's kind of like when people can be in contact with me, I can sleep at night. I can sleep at night. And I tell them it's kind of selfish because I want you to know that you can contact me anytime. And then I know if you will contact me and you feel fine with that, then I can sleep. So if I can keep that communication open with the patients, if they know they can contact you, and the reason I have this is because a few years ago I helped another provider with an adverse event with a nose. She had a massive occlusion in someone's nose. So I went up and helped her with that. She had injected the patient on a Friday. They were closed Saturday, Sunday, Monday. She saw the patient on Tuesday. It was pale, mottled, all vesicles, starting to get some necrosis. The patient couldn't get a hold of her. So from that day on, I'm like, nope. I give them a card that says post-filler aftercare, what to watch out for, all the instructions of what to watch out for, office number, and my cell phone number. And everybody that I inject fillers gets that.
Lori, do you do noses?
Nope. I used to.
Tell you.
I did before. I never had a problem, but the more research that comes out,
Yeah.
I don't choose to do it as a provider.
Yeah.
I don't choose, even if they have given me consent, like, I know I can go blind, fix my hump. I'm like, no. I'm not going to do something that could potentially make you blind for a little bump or a wrinkle. Not going to happen. So even if they give me consent and they understand, no. No, I'll send him to Gideon.
Labellas. Yeah, send him to Gideon.
He does them every day. But that's part of the thing where as a provider, you have your choice. And I have a very low risk profile with my patients. I have a low risk. If something is going to put them at undue risk, I just choose not to do it. And that's just me as a provider. There's lots of providers who do noses and inject glabellas. And I'm like, fine, you better give an informed consent. And they better sign that they could possibly go blind for that wrinkle. And it's on you. It's like, I don't want to curl up in a ball
I love
and
that.
never wake up.
Informed consent. You could go blind for that wrinkle.
Yeah.
I love,
Yeah.
that's really smart because that kind of puts it into perspective, right?
Yep. I'll do threads. I'll do smooth threads, glabellar lines, but I do threads in the nose. Love threads in the nose.
Threads in the nose. I'm new
Love.
to this.
Phenomenal. I love it for the right nose, for the right anatomy, but not a big hump. But if somebody has a little wider bridge and you want a little nose, the little tip to come up, it's beautiful. So, and you're not going to go blind with that. So that's really nice, really nice. So I do that, but not fillers.
But yeah, you just kind of made your decision.
I did. Once the research started coming out and I saw the incidence of blindness, I said, nope. And I don't allow it at my clinic.
I was just going to say, so that's a no-no in your clinic.
It's a no-go.
Temples, I assume you're fine with.
I do it with ultrasound only.
Okay.
Personally, yeah.
She does it with ultrasound only. So Lori, I have ordered my first ultrasound
Yay!
machine.
It's hard.
Okay.
It's so hard to learn.
So I had GENNow on the show.
Yes, I love GENNow.
Okay, she's amazing. And
She's on faculty with us.
I know. She's awesome. And I shared with her, should I get one? Like, I'm not sure, because I see filler that's misplaced. I see things like that I try to dissolve. And I thought maybe that would be helpful for me.
So helpful.
So she said she'd help guide me a bit with that. And she's really stepping up the ultrasound training. I think, GENNow, you should, because she's great at it. But it takes a lot of practice, is what you're saying?
Oh my gosh, it does. I've had mine for probably almost 2 years, and I feel like I'm still learning to differentiate the 50 shades of gray.
Do you try to do it daily, at least get
I
a
almost
visual
do
with
it daily.
Okay.
Almost. And I'm doing a study now with Professor Cotofana. So I'm using my ultrasound on certain muscle structures we're studying more. So I'm using it almost daily. I use it for every nasolabial fold, piriform, and every temple. So that's a
Do you do
fairly
it?
common-
So you do it ultrasound guided then? So you're able to hold the ultrasound. She's able to hold the ultrasound and guide it in to the piriform.
So what
and
I
inject?
do is I will say if I'm doing piriform, I will take my cannula and I will go in and get down deep where I want to go.
That's right. You like to use a
And
cannula.
I use cannula. So I've used 25 gauge 1.5 inch needles also. I just, it depends. If I'm using ultrasound, I'm okay to use the needle, but there's arteries that are very close to the bone there. And usually that's infraorbital arteries that are coming down next to the bone. They might not be touching the bone. So sometimes there's a little bit of fascia that's above the bone there, and the cannula is tough to get right under it. But I do like using, what I do is cannulas or needles is I'll put the needle or cannula into that fossa, and then I lay my ultrasound on it. And then I start looking at vasculature around it.
Okay.
And I look at where the needle is in position with the vasculature, the angular artery and some of the infraorbital arteries. Where are we with the vessels? How close am I to any vessels? And then I can inject. So it's kind of for a vascular identification. Same with the temple. I'm doing it to look at my layers and make sure I'm in a specific layers of the temple before I inject. They're pretty avascular between layer 4 and 5. It's like I'm above the deep.
There's
the
a lot of
superficial-
dexterity with this, I assume.
Well,
or you have an
not
assistant
really.
that
I have an
helps you?
assistant, but what I do is I'll put my cannula in. I can feel it with the temple. Put my cannula in. I'm left-handed, but put my cannula in, and then I lay the ultrasound on top.
I knew I loved you. I'm left-handed too.
I put the ultrasound on top, and I
Okay.
start looking. And what's nice is you gotta get the VR goggles with your ultrasound
Okay.
because those goggles are phenomenal. Because I don't have to keep craning my neck over at the ultrasound. I can look anywhere with the goggles, and I can be looking over here, and I got the ultrasound here, and I can see everything on my goggles. They're amazing.
Oh, wait. You're putting a goggle on,
They look like Helen Keller glasses.
and they're in your eyes. So you're not looking over here at your phone or your iPad?
Nope. It's the one I have is a big stand-up unit, but I'm not looking at the ultrasound machine because I can look. I can look in my glasses or look above the patient wherever. I have a tendency. I was laughing the other day.
It's like progressives, but for ultrasound.
I have a tendency to do this when I'm, and I laugh and I'm like, because they're black, I go, I'm like Helen Keller.
They need to video you doing that. It would be hysterical.
I need to lower my head because I tend to look
the
up
facial expressions you're making
so
probably.
Funny. But they're awesome. So that's something I'm really glad that I got. And Alfredo from Musculoskeletal Ultrasound, he's back east in Florida, and he is someone that helped me upload some of my settings for my ultrasound, which are phenomenal. I have one setting, I can use it everywhere. I don't need a bunch of different settings for different places I'm ultrasounding. And he's phenomenal. We're going to have an ultrasound course here. I think it's October. So we're going to have one here in our school.
I got to wait till October.
I think it's October. I'm not sure. It's probably on our website. But we're going to have a 2-day ultrasound course here with Candace Drury, who's a phenomenal sonographer out of the Northwest here, which is great.
Again, let's talk about experience. Do you think someone needs to have some good experience first with the needle and a cannula before they introduce ultrasound guided?
Yes, I do. Because you've got to know what you're looking at. You have to know what you're looking at. So there's so much to it. There's so much to getting the needle placement and what you're injecting. To add ultrasound on kind of is overwhelming for a newer injector. But nasolabial folds and piriform are the 4th leading cause of blindness. So do I want somebody sticking a needle in there and blindly? I really don't. So
Those are kind of simpler places, especially if they're doing a needle. They're not doing ultrasound.
Yeah.
I think that would be an easy start.
Well, that was
for
where we
ultrasound.
used to teach them to start before we knew it was the 4th leading cause of blindness. So now we start on cheeks for new injectors. We don't really start here.
No, but I mean with the ultrasound.
Oh,
like
yes.
Ultrasound guided would be a great place to start is in this area, right?
Yeah, it's a great place to start. Chin, nasolabial, so you can kind of start to see the layers and have somebody to mentor you who knows ultrasound. In fact, I'm going this weekend to a complication management course with ultrasound with Leona Schelke.
Oh,
that'll be
pretty
awesome.
amazing.
And Nicole is running it too. So it's I think we can never know enough, no matter what. Keep seeking education because it's not as easy as what it looks.
Nicola has been really doing the ultrasound thing a lot. And I got to spend the day with her and shadow her and watch her do some dissolving ultrasound guided. And, watching the dexterity, she said there's a learning curve.
That's advanced. It is really advanced.
Super
And I do
advanced.
that with my ultrasound too. But I think no matter what, the more we do it, the more we're guided by people who are just really good at it. I think it's just going to help us bring us up. So I think we need to never stop seeking education. No matter how much we think we know, we'll never know it all. And we need to just keep our minds open. The minute you close your mind off, you're done. Your history, you are going to fall behind.
Agree.
The minute you think doctor, nurse, whoever you are going to, the minute you close your mind off to learning, you're falling behind. You are totally falling behind. So we have to stay open to that.
And have your people, that's my big thing, is have your people, your team, people you can reach out to, they can pick up the phone with and call.
Absolutely.
Don't isolate yourself. You new nurses do that, It's like, I want to start my practice tomorrow. My dad's friend's a doctor. He's going to be my medical director. You cannot do that in California.
And I've done one
by the
class.
way. And I've done one class.
I did a 2-day class in aesthetics, and I know this was on my podcast with Keith Hanian, but I tell you it, I see it, and I got a lot of hate mail for it, like you're rude, and it's
truth hurts.
But it's looking. I'm being very realistic, and I'm worried for the patient.
Yes.
So you can be very experienced in any other specialty, labor and delivery, emergency. I don't care what it is. It doesn't mean you're experienced in this specialty. And every specialty takes a residency period. It takes a period to learn and get better and to feel more comfortable. You're never going to feel 1,000% comfortable. I never do. And you're constantly going to be adjusting and looking. I see the recent Instagram people going around like, here's your injector, like looking this way and looking this way. I still do that all the time. But it's just one of those things like it's artistic. We're artists. And we're constantly looking like, do we need more blue here and more pink here? And I always say that when injectors are new, they're painting within the numbers. They're injecting 0.1, 0.1. They're looking at the syringe, 0.1, 0.1. They're looking at the syringe, so you're staying within the numbers. as you become a better and more experienced injector, you start to just inject and you're watching the tissue. You're watching the changes of the tissue. And that's where we're kind of painting outside the numbers a little bit. And that's when you know you've become a little bit more experienced and you're getting to be a little bit more advanced, is when you start looking at what you're creating rather than the lines.
Then, yes. The kind of the robotic moves that you need when you first start. Those are important.
Oh, exactly.
Those are important, but also not isolating yourself. That's the scariest thing you can do. Be around people you can pick up the phone with, you can call. When you have a question, because I have questions every day. I look at my assistant every day. I'm like, was that blanching? Because I second guess it all the time, right, Charlotte?
Yeah.
Because we do. I mean, and that, I think that makes you a better provider, a better aesthetic nurse, PA. We're physician's associates now, not physician's assistants. I've got to get that right.
And we're not saying that ML word.
No. Master.
Mid-level.
Oh, mid-level. Yeah. Oh, mid-level.
We're not it's kind of a slap in our face.
It is. So mid-level, if people don't know, they look at nurse practitioner as a mid-level provider in healthcare. It's a very it's kind of demeaning.
It's very. I think it's very demeaning. I think somebody just thought of that as being like, you're not a physician, you're not a nursing assistant, so you're mid-level. But statistically, nurse
what is a RN? A low level,
right? a wannabe? I don't know.
I don't get it.
And RNs, there are RNs that are so smart, that are so good at what they do. I think sometimes when you're very experienced in aesthetics, you have it's that time on tissue, and it's that seeking knowledge. There are RNs who are heads and shoulders above PAs and MDs and nurse practitioners.
Oh, agreed.
So it really is a personal thing. If you strive to learn as much as you can be as good as you want to be.
You can take it wherever you want.
Yes, you can.
It's just an investment in you, yourself, in your patient. Patients first, safety first. That's how I feel. And I know that's how you feel.
Right.
And that's what aesthetic immersion is all about. That's why I love what you're doing. It'll be interesting to see where it is in a decade, what comes out of it. It will only be good.
I'll tell you what's really surprised us is that we started the aesthetic immersion to have classes and educate and just have really good quality information. During COVID, we had planned on doing webinars, but during COVID, we were ready to flip the switch to webinars. We were at that point where we were ready to flip the switch. So we went online to webinars and such and Zooms for education. So a lot of people did, but we were ready. And our production side, the AI studio side, has taken off like wildfire. We had no idea that
was going to happen.
That there would be such a need for an aesthetic or medical studio. So the companies, Immerse, Galderma, Allergan, the companies contract with us to do a lot of their education. You were here at the GENNow one with Galderma, and they contract with us to do a lot of their education because we have like the newest equipment out there. And like the next few months, our portable AI team with our big van with a lot of our portable equipment is going to be in Houston and then Chicago and then Pennsylvania with Galderma.
You're portable?
We have a portable transit, one of those Mercedes transit vans, the aesthetic immersion.
They'll come to you.
And, and we've got a lot of the portable equipment and scaffolding and stuff that we can
That's awesome.
take.
To different locations, different schools, different education areas, to actually expose them. That is amazing.
Yeah.
COVID, you mentioned the word.
Yeah.
How was that for you?
In what way?
Are we talking
Where do you want to go with this?
Oh boy, we could go. How was COVID for business?
We
Did you guys shut down?
We shut down for a month, and what's funny is I had colleagues that didn't shut down, and I walked away from them, and it's because it showed me that the focus was money and not patients, because we didn't know what we were up against for a while. We didn't know.
That first couple weeks, especially, we
did not know. And in California, we were shut down for about a month. Thank goodness it taught me. I've always been in business wise. I never want to be. I don't want to owe a lot of money to people. If I buy a piece of equipment, I usually just pay it cash. I don't like a lot of liabilities. Thank God I didn't have a lot of liabilities because we were able to be fine, pay the staff, and be okay. And a lot of people went under because they couldn't still make the rent, all the fixed liabilities that we have with business. So I was really, really thankful. And then after that, everybody in the world ran in because their wrinkles were worse than normal. And so we were really, that next year, we were really hit heavy with people who had saved their money up the year before because they were afraid to leave their house, and did quite a bit. Now, the last couple years, it's really mellowed a lot. And we're finding in most clinics that people are really much slower than they used to be, that they are not growing exponentially like they were in the last few years. And what's kind of hard is some of these big pharmaceutical companies are putting demands on the clinics to say, okay, you need to grow by 30% or you're going to lose your cut that you get, the reduced rates that you get. And nobody's growing by 10 to 30% right now. We're in a recession, if you want to say it or not.
We are.
We are in a recession. So people are kind of watching and holding on to their belts, and they're just a little afraid to spend a lot of money. So it's this. I went through the recession in 2007 in aesthetics. So did you. And we did fine. Like I tell my staff, you know what? You just ride it. We will be perfectly fine. We have patients that we're still busy every day, but it's not. We're not growing by 30%, but we're still fine, and it's a hump that we got through before, and you get through it this time.
Part of business.
But I feel bad for the reps because from the pharmaceutical companies, because they're being put under such stress to sell more, and yet their clients, their customers, aren't growing at that rate. So I feel really bad for some of the pressures that are put on some of the reps because I think it's not fair.
I've noticed a difference in filler. The investment in filler that people want to make. Newer, it's not your regular clients, it's more the newer client. They're transitioning more to skincare and things like that. They're watching their dollars because we're in a recession. But COVID was a real fun time.
Yeah, well, I could go off.
It's amazing. It was 4 years ago, right?
I can't believe it was 4 years ago. Yeah, it changed my views on many things. It did. It changed my eyes were opened in many ways.
Yeah.
So yeah,
I was asleep. I was asleep.
I was asleep too. So it was very interesting. And I always think when we're open to learning new things and we always keep our critical thinking hats on, that's always good. I never want to be a sheep. I always want to look at things and evaluate and go forth with information that I get. So I think it's good in any aspect of life to do that, you know?
In business and in
absolutely.
personal life and faith, you always have to look at something and question it, even if it's for a minute.
Yeah.
Before you dive in. So,
and I always we tell our students too, like, you might hear things on podium. Don't take everything as
truth,
honest truth. Think about it. Like, why is this? Like, I can't go get a facial for 2 days after Botox. Why? Think about it. You know that the toxin attaches.
What is that about?
It's a wives' tale that probably somebody said on podium, and it's just spread because toxins attach permanently to the nerve, to the motor end plate within 90 minutes. So I tell my patients, just wait 2 hours to do whatever you want to do. Yeah. Can you not lay down? Yes, you can lay down. That's a wives' tale. So it makes there's no research whatsoever on it. So you hear things sometimes up on podium or you see things, and I just don't want people to always go, okay, that's God's honest truth. No. Think about it. Think of why. Always ask yourself why. How? Why is it that way? Why are they saying that? Research it. What's behind this? So keep that critical thinking hat on. Never take it off, no matter what. Keep it on. Always ask why.
Always ask why.
Yeah.
That's awesome, Lori. That's great advice. Finally, I'll just, before we take our little tour, because we're going to take a tour of this fantastic facility, new trends. New trends.
You're full of good questions.
What are they? I actually have two questions for you. But the first one is new trends. I have my own. What are they, and do you think they will last?
Okay, so new trends. Exosomes have been around for a while, so they're not so new. PRP is kind of a thing of the past. You know, Europe stopped doing it years ago, And I think we're just slow, or people don't want to give up their spinners. They're like, no, I paid for that. I don't want to give it up. But exosomes are phenomenal. I think that we need to be very critical in looking at how they're harvested, where they're obtained, what we have, what the companies say about them. And we need to kind of look back and really validate
I agree.
what you're using. I think that probably one thing that I have been using recently that is new is something called Avali, and it actually fixes cellulite. So that is a little tool that a lot of people don't know about, but it subsizes the little septae. So you're just cutting the little septae up by the skin, and the skin pops up, and the butt gets really round, and it's really pretty, and it's beautiful. It's a one and done. It's a bigger procedure. Our malpractice only lets nurse practitioners and up PAs and up do it, but it is a really nice newer procedure. So it's beautiful. We've had procedures for cellulite before. We had Quo, mess. We had Selfina. They're no longer doing the Selfina. They don't have the parts to it anymore as far as the little tips, or the little suction cups. So that also subsized the septae, but it did it more generally. This Avali comes in with a tiny, tiny, tiny little scalpel, and you kind of hook the septae and deploy a scalpel and just cut little pieces. So you're just gently cutting it. So it's permanent. Right now they say a year, but it's not going to come back. That's a beautiful treatment. Another one that's new is Brella for underarm sweat. So it is a sodium, it's like a heaviest sodium metal
I haven't heard of that one.
It's pretty new, Brella, Brella.
That's because she's in the know with all the people that are in the know.
And it's an alkali. It's a sodium alkali.
Okay.
So on this little patch that's oval, it looks like your armpit. It's an alkali. It's a sodium alkali on there. And if we know alkali metals, sodium, potassium, and lithium, if you put them in water, they can catch fire. So you clean off someone's armpit, put the patch on there and you just kind of rub it, and up to about 3 minutes, or when they get to a discomfort level of about 7, then you just pull it off and neutralize it with water and dispose of it. There's a special way to dispose of it. And it will reduce underarm sweating by about 50% for about 3 months.
I was just going to say, for how long?
About 3 months, about 50%. So not all the underarm sweating, but if somebody has hyperhidrosis, it'll get them back down into a more of a normal.
Feet, hands?
They haven't done research on feet and hands yet. They're doing that now. But it's been really nice, as opposed to double the price for toxins.
I was going to get to price. So this obviously is a more reasonably priced.
It's about half the price of toxins.
Hyperhidrosis has never been covered by insurance, has it?
No.
Are they leaning towards that with this, or no?
I doubt it.
Okay. So this will be considered a cosmetic out-of-pocket
Yes.
procedure.
Yes.
Half the price of toxin. That's Brello?
Brella, Brella.
Is it out of
Brella?
American
US.
Pharmacy? US?
Yeah.
Wow. You heard it here. You heard it here. That's cool.
Yeah.
Anything else that you need to tell me?
Well, I'm trying to think of
Come on, Lori.
new little trends. I have to be mum about our research, but we're going to change the world of masseters. When Professor Kodova and I finish our research, we're going to change that world. Everybody's going to be turned upside down because he and I are going, oh my God, really?
Wait. Is this like going to change people with teeth grinding and that kind of thing?
It'll change our
perception
of what's going on there. So that'll be interesting. So,
okay.
Yeah. But anyway, that's just,
he's all over the place.
He is. And he's getting married in August.
He's all over the place.
He is all over.
I feel like I don't know, you know him from his platforms, but he seems pretty humble. He seems pretty not it seems like things come to him. People come to him.
He is. He's a quieter guy. He's an introvert.
He's an introvert. That's what I meant.
He's a quieter guy.
Research-based.
Totally research-based. He is an analytical thinker. He is, for someone to have an MD, PhD, 2 PhDs and MD by the age of 38.
Yeah.
He's
Thinks
brilliant.
Than the rest
he's
of us
brilliant.
do.
But what I love is he's just so invested. It's anatomy. He is the only anatomist by degree that we have in the United States. We don't have another anatomist by degree. We have a lot of plastic surgeons who have a passion for anatomy, who love to teach anatomy. but we don't have a true anatomist. So when you go to his cadaver courses, they're kind of at a different level. And it's funny because we've done several cadaver courses with him. We've had him here at our school several times. And I was sitting next to him one time when he was dissecting a chin, and I looked at this red thing. He has the arteries injected with red latex, and I saw this red thing coming off the facial artery and going down here and then coming up here. Right? That's me. I was like,
How does that
and I'm thinking, and I'm like, I don't want to say anything because I'm going to sound stupid, because whenever I say something to him, I just sound so stupid because he's so smart. I just am intimidated because and I'm like, I don't want to sound really stupid. So I look down and I'm like, I'm just going to ask. I said, is that the ILA? And he said, yes, it is. I'm like, I'm done. I'm done. The inferior labial artery went off the facial artery down to the chin and up to the middle of the vermilion body on the lower lip. I go, that told me I know where nothing is in the face. That's why we go by feel. That's why I've got to go by feel, because we don't know where anything is. We know where textbooks say they are, but everything is moved. When you do cadaver courses, like you look at two heads and you're like, that artery is different and that artery is different and that fat pad's different and that fat pad's different.
If you take one of his courses, do you think it's important to be a little more, have some cadaver training, like go to another one first?
I think probably go to about 3.
You can never go to enough, right?
I think the first 3 cadaver courses, your head is still spinning because there's so much to learn. It's overwhelming. My first one was with with Galderma and Chris Zurich in University of Texas in I think it was Houston or wherever I was. But I remember they gave us scalpels and we had the specimens, and we were supposed to kind of look for the angular artery. And I took my scalpel and I was cutting down in it, and it sure as crud, I cut everything in half. I'm like, whoops.
You think,
Whoops. So it just takes a while to figure out. And I watch him a lot, like how you dissect and tease the tissue away and look for layers. And it takes a while to figure out what's what. And it's dehydrated tissue, and it's very
different than a live,
very different.
Warm-blooded human
It's
alive.
thinner and it's dehydrated, but you really can see. You can get to those arteries. You can see where they're coming out of the bone. Oh my gosh,
the layers of skin and muscle.
It's priceless.
It is, and they're expensive.
Yes, they are.
So I know my recommendation would be, and you tell me if you agree, you could disagree, would be don't spend $15,000 as a new injector in a 2-weekend course in injectables. Maybe do a small, simple injectable course and spend some money on a cadaver course. That will give you that respect for what you're going to do under the skin.
Right. I think probably a cadaver course wouldn't make much sense to newer injectors.
Okay.
Probably, I generally tell people inject for a little while and get the feel.
And then
and
go do it.
No, you're not. And then kind of go through it, and then you have an idea of what you're looking at. It's hard enough with experienced injectors, let alone a new one might be a little bit overwhelmed. My new nurse practitioner happened to run in and grab an opening of a cadaver course she was offered, and she went and she loved it, but she was overwhelmed.
Mm-hmm. Yeah, I guess it could be overwhelming. See, you deal with all the new students, so you know exactly what they need. See, Lori knows what you need. Sometimes people, like, if we mentor or shadow people and we don't do it enough and we're in our own world and we don't spend enough time with students, it could be detrimental to your advancement in this industry if you don't choose accordingly in your basic education moving forward. You really need somebody that understands and can guide you in a program that can guide you. And that's why I'm so excited about what you guys are doing. And I just want it to multiply for you. And I want to be as supportive as I can and send people your guys' way. And I sense your faculty will be growing immensely because you will not be able to keep this pace for long.
Yeah, no, we're currently adding faculty, so it's good.
That's exciting.
Yeah.
Lori, thank you so much for being. Oh, one more question. And then we're done. And then we're going to do a walkthrough.
Okay.
If you had one filler, only one, that you could be on the desert island with, which one would you choose? You only get one type.
One filler on a desert island, it would probably be Restylane Lift.
Restylane Lift. You heard it here.
Yeah, I can put that. I can kind of put that anywhere.
Anywhere.
But one filler's not good for everywhere, you guys. I don't care I don't care what they say. You can't put one and make it look good everywhere.
That wasn't the question, Lori.
I know, but if I was stuck on a desert island and I had nothing, it would probably be Restylane Lift. Yeah.
And if you were on a desert island and you only had one choice between a neuromodulator and a filler, which one would you bring?
Oh gosh, depends on what the islanders' problems were. Are they thin or are they wrinkled?
Well, I don't know.
I can tell you what my toxin of choice would be.
I know what that is. What is that?
The only one I use in my clinic is Dysport.
Yeah.
Why? Because it has more nanograms. It has more core molecule in the dose, so it's a higher dose, pretty much. Yeah. Drives me crazy.
She's telling you everything. She's giving away all her secrets.
It's not my secret, it's research.
It's research.
Look
but
it
it's
up.
still
It's all
Lori's
good.
secrets.
Toxins, 2018.
Lori, take us on a tour. So we're going to come right back, and she's going to take us on a tour of aesthetic immersion. Super excited. So Lori's going to take us through a guided tour. I'm so excited. We're going to give it over to Lori. Lori, take me on a tour.
Okay, so we're going to go through the aesthetic immersion. I'm going to show you this room that we're in now. So the backdrop, we use this a lot for a lot of our conferences and our booths and education backdrop here. We're going to let you kind of come around. We have TVs on both the walls. TVs back here, that's our monitor that we can do our kind of teleprompter, read off of that when we do a lot of our AI lives and our different kinds of webinars that we do when we film. All the cameras in here are all 4K cameras. This TV up here is a timer. We have other TVs in here, and mainly the TVs that are on the walls around here are when we have students in here sitting for education and we're injecting or we're lecturing, they can see what's going on the walls. And we can open this entire glass wall up.
This is a
it can go,
huge
it can
deal.
fold and go totally flat. It's soundproof, this whole wall. And we can make it one big educational room, which will hold about 80 people, 60 to 80 people. When we want to do different training courses, we can close that wall off and have a chair here for a model, and then the students here in different chairs, and that room. So we can
Lori,
have two
you
different
guys
rooms.
had it set up for Galderma. I mean, there must have been
was-
80 chairs in
Yeah.
here, and then you guys had two different chairs going with different, oh my
Yep,
gosh,
so we can
it
set
was incredible.
Like different ways. We have TVs everywhere, so we can do whatever we want on the different TVs. Out through this room is where our students come in, and we kind of greet them in the morning, where the students come in. We have our next cadaver course is with Dr. David Sadat, so you see his picture out there. He's got a wonderful
Yes.
cadaver course. They come in here and they get some coffee and kind of get to know us. We have little, food up here for them, and then we'll go in and do our education.
Very nice here.
And then we expanded about 2,500 square feet. So this is the new booth. So we have a lot of different monitors in here, monitors to kind of catch up on everywhere we're going. We got sound, all kinds of stuff. We tilted these windows on purpose so they wouldn't glare when we're filming. So
Where did you film before? You said
I'll show you. Right down
Okay.
this hallway is where we started the aesthetic immersion. It's a little bit smaller. This is where we had 10 students in here, 10 to 12. Right now it's set up. We're going to do something for Immerse on Monday, some filming. But we can set this up. We have all the scaffolding up here, still have all the 4K cameras, all the lighting. It makes for a busy time.
Lori, when you're doing it for Immerse, is Immerse coming in and doing it, or are you doing it for them? How is that
We're
working?
doing it, we're filming for
For
them.
them?
Sometimes they'll come in and they just rent the studios.
Use your facility.
And they have their own injectors and their own KOLs and
Okay.
such. Sometimes we'll do things for them. Like Mint, Gideon and I both train for Mint, Galderma, so
Okay.
we might be a KOL for them and do the training. But
Okay.
that's totally up to them how they want to do it. And now we've got 4 full-time videographers and editors, and here's Amon, here's one of them. It's late in the evening, so they're all home. But they sit around here during the day and they're always editing, and they come up with really great ideas for good stuff, fun background and the sci-fi stuff and all the great special effects. It's all these people. So they come up with really cool stuff. So this team back here is in charge of all of that, and they do a great job. So this is our first booth. This is the first one. And we expanded to the one that we just showed
baby
you
booth.
in the other side. So we're capable of taking a lot of our school on the road and a lot of our portable equipment to film. We have a large van, like a transit van, and right now it's in Houston for Galderma, and it's going to go to Pennsylvania and Chicago after that. So we can take a lot of our things on the road with us. We're going to be doing a class for the aesthetic show
we're doing a full day class before an educational injection course the day before the aesthetic show. So our van will be there and set all the cameras and everything up for the aesthetic show. So it's pretty crazy. It's fun.
Dream big, people.
We are here for the right reason. We're very blessed to be doing what we're doing, and we are here to help our students. We are here to help them be the best that they can be. And I think that comes through in our education. And that's so important, because everywhere I go, we are now being really known as quality education. And when I hear that, like, oh, you guys, I hear about your quality, and I'm like, yes, we want that. We're not here for the money. We are here to instill that critical thinking and the knowledge in our students so they can be safer and more knowledgeable injectors. So
we're at a transitional spot right now. Aesthetics is a baby.
Yes.
It's a new baby. And if we don't do some sort of self-regulation, which is what you're doing, we will be regulated, which is what is happening in Australia.
Kind of need to be a little regulated.
We do, but self-regulating, which is kind of the path you guys are taking, is saying, hey, wait, let's all slow our roll. Let's not let social media run it. Let's let medicine run it.
For social media, it can be the best and the worst.
It is.
And it's up to providers and patients to sift through that and to vet your trainers, to vet your providers, and ask lots of questions. Don't just assume that something looks like beautiful, because there's a lot of smoke and mirrors out there. Really vet people that you're learning from, and patients, make sure you vet your providers. Ask them questions. Where did you go to school? How often do you do research? How often do you go to conferences? How long have you been doing this? Those questions, I don't mind at all. In fact, I respect somebody who asks me those questions. Check on my license. I'm good. I love that, because I love patients who take an interest in their care.
And that's what you're going to teach. That's what you're teaching.
Yes.
We'll teach all the new people entering this amazing industry. These are the important things you teach your patients. So I love it. I'm excited. This is so cool.
It's awesome. It's fun. Thanks for joining us. It's really fun.
Thanks for the tour, Lori.
You're welcome.
Thanks for spending the long, late evening with me. I appreciate it. And
I have a question for you.
okay.
So I do have a question for you, because this is so cool. You have a team here. I'm so impressed with the team you have here. And you've been doing this a long time too. I want to know kind of how you got into, how'd you start this podcast? How did you get into this?
Okay, so I was going to do a little education out of my office. So I built my office out. I have a little educational area. And I thought, I can't change the world one person at a time, one nurse, one PA at a time. I'm limited with what I have. And education has just taken off. And so many others have so much more than I have to offer when it comes to that. And I was a little seed. I've been in business 30 years, but I didn't have a social media platform. And I woke up on January 1st this year, and I did my goals for the next 90 days. And I said, I'm going to learn how to do a podcast. And I'm going to educate the public on safety. And my husband said, you don't know how to do a podcast. And I said,
You're like, hold my beer and watch me.
exactly. And I locked myself in a room for about a week and researched it. I ordered everything off Amazon. I got my little stands, my little thing. I did this little thing on the And my girlfriend's a photographer, and she said, I'll come film it. That'll look really good if we film it. And I have a guy that can edit it. So we did esthetician diaries. I started there with scope of practice with estheticians, because that's the Wild West as well. They think they can do filler, and they can't, poor things. And I thought, okay, we did one. And then this media team that I have now saw my first one, and they called my assistant and said, hey, can I get in front of your boss? Because I think this would be really good. And I met with him, and I decided this is where my investment's going to change public view and public safety.
I love that.
And I'm a nobody, and they were like, you have to have a social media platform. I have 380 followers on Instagram.
I follow you.
I know. And I was like, if I could get the big fish, because she feels the same way I do. She's just changing it the way I wished I could. And we teased about you because when you would text me or we would do our little exchange, I'd be like, my girlfriend texted me back. Anyways, I believe it takes a village, and I'm just this little seed, and I'm interviewing all these amazing people, and you're one of them. And my goal in life is public awareness and public safety, and I know you have it. And if I could do this little thing with my 5,000 reel views, yay,
Good.
I can change many people, right? I can change their mindset. And then I can also send nurses to viable areas, PAs to viable training. And that's why I did it.
I love it.
And look where I'm at.
Because you're here
In
for
May.
the right reason.
I'm right here.
You are, but but what got you here is your core value. That's what got you here, and that's what's going to make you successful. Is the core value is you? It's your core values and what you want to bring to others. You just let it go because you're doing beautifully. You're doing so good. I'm so proud of you.
Thank you.
Thank you. It's an honor to be with you today. Thank you.
Are you my girlfriend?
I'm your girlfriend.
Thanks for being with us. Now, Lori, tell them how important it is to like and subscribe to the Beauty Outlaw.
You guys, it's super important to like and subscribe to the Beauty Outlaw because you're going to get more podcasts kind of like what we have, and you don't know it all. So you keep learning and you keep searching for things. And every time you hear podcasts like this, you are going to learn something, and it's going to be valuable in your practice. So like and subscribe.
Lori, she does have a podcast. You guys have a podcast.
We do.
What's the name?
The Aesthetic Immersion. Yep.
Oh my gosh. But it's really cute because I've seen the cover. I think you have a syringe.
I can't even remember.
It's super cute. Anyways,
Our team does it.
she already has a podcast. Anyways,
It's fun.
it's fun. And now I have a podcast.
I don't have enough to do.
So you've told them to like and subscribe.
Yes.
Okay. Came
Like
from
and
Lori.
subscribe.
And if you don't, Lori's going to come get you.
Yeah, I'll come search you down.
Thanks for joining the Beauty Outlaw. And we're going to have Lori back someday in my office. Oh my gosh, wouldn't that be amazing? Maybe a year from now. Anyways, thank you. Like and subscribe, and peace out.
Peace out.